Welcome to Madame Noire special election coverage, where we're discussing the issues that matter to us as women of color, especially with the general election approaching us on November 8th. Before we get started, it's important to know the issues that affect us most and why our vote matters. The first issue is healthcare. Generally, women are less likely to be insured than men. Due to limited access to healthcare, as demonstrated with tightening restrictions on healthcare options like Medicaid and plans to defund Planned Parenthood, Black women are disproportionately affected. So we have with us today image activist and creator of Mad Free, Michaela Angela Davis, journalist and author Kelly Goff, who's a contributor to the Daily Beast and WNYC, author and producer Kim Osario, and president of the National Council of Women, Saida Brown. And I'm managing editor of Madame Noire, Brandy Victorian. So first we want to start with the issue of healthcare. It's clear that health insurance and access to healthcare is an issue for women of color. Hillary Clinton has stated that she will protect and expand the Affordable Care Act, while Donald Trump plans to repeal the Affordable Care Act. So understanding the opposing views on health care, what does this mean for us if the ACA is repealed?
Well, one of the reasons that African American women have substantially higher mortality rates when it comes to breast cancer than other groups is because we're diagnosed later. Right. And so one of the reasons we're diagnosed later is because lack of access to care leads to a lack of preventative care, such as getting mammograms. So one of the benefits of Obamacare, even though it's been ridiculed by a lot of conservatives, is it's helped people of color who were poor and could not afford health care before to get better preventative care, which saves lives in our community, particularly among women of color.
Yeah. There's some real basic issues that are on the table that could be in jeopardy or could be eliminated that will directly affect poor women of color in a way that is diabolical. It's hard now. Like if you live in Mississippi and you want to get birth control or an abortion, like you have to go to another state. Like there are already things that are in place that are affecting Black women's health in a way that most people don't understand. And if you're undocumented, forget the lower you are, the harder it is. And healthcare is just one of the many things that that it is critical that we don't let that Cheeto run this country because poor people will perish.
Yeah.
I think the big thing with the Affordable Care Act is just that it's a step in the right direction for us, and to go backwards, to even think about going back to Roe v. Wade, because you brought that up, right? Yeah. I mean, it's just it's mind-boggling to me that we would go backwards and have to kind of do things all over again. So although there are kinks and there are problems, I think the Clinton administration wants to fix that, sort of go in and make the changes, because, I mean, our healthcare system is jacked up. There's no doubt about it. I'm somebody who, I've had my own personal struggles with healthcare over the years. It is incredibly costly, and I just, even with the Affordable Care Act, right?
Yes.
There's still issues.
Yeah.
It's incredibly costly, incredibly complicated. When you have children, it's just unreal. If you don't have a job and you're just freelancing or doing whatever, it's unreal the amount of money that you have to pay.
I actually, as a writer, I was actually on the fence about whether or not I was going to support Obamacare in the early stages because of the cost associated with it, because we're so much larger than most other countries in terms of population. Places like Canada that they always point to have much smaller populations than we do. So my point is, these problems and chinks in the system, we anticipated.
Yes.
And I have to say that for people like me, who are doing okay, in terms of a cost-benefit analysis, for me, some of my costs went up. But the trade-off that I'm willing to make as a good citizen, and what finally won me over, are people in my life who admitted to me they never had health care.
That's right.
People who'd been working for years, who if you'd asked me, I never would have said, of course, she's doing fine. She has a great job as a freelancer. But these people never had health care. So to me, part of being a good citizen is saying that I am willing to deal with some of these chinks that may be a bit harmful in the pocketbook to people like me in the short term for the long-term benefits for the rest of our country. And one of and to that point, in terms of the larger benefits, I think, to society at large, is not only that people who have pre-existing conditions have finally been able to get coverage, which is it's such a significant thing to think about, that if you were born with a disease a few years ago, you would not have been able to get health care coverage when you're one of the people who needed it most, but also that birth control was finally free.
Yes.
Now,
Yes.
I can't think of anything that's more preventative than birth control.
Right.
And yet there were women being priced out of birth control. And then when they got pregnant and couldn't afford to raise a child, people either judged them because they had to go on government assistance or judged them because they contemplated terminating a pregnancy. That's the society we were living in. So that to me is actually one of the most significant benefits of Obamacare.
We have to look at the suppressive laws that will be put in place, like mandating that doctors who perform abortions have access to hospitals, or they have admitting privileges at hospitals. That's crazy.
Yeah.
So, you know, we're in New York City, we're in a metro area, we have ample access to free clinics. And I will say, I got pregnant my senior year in high school, and my family had means, but I didn't want to tell my parents, and I went to a free clinic. And they did pregnancy tests, and they did all these other things, and said, Saida, you know, here are the pills that you know, the vitamins that you, so they took these steps before I even had the courage, you know, I'm thinking I'm grown, before I had the courage to even tell my parents that I was pregnant my senior year in high school. And so should I have made a different decision possibly to terminate the pregnancy, look what suppressive environment it would have been in if doctors were mandated, even in New York City, to have admitting privileges to hospitals, which now prohibits and extremely limits our access, especially for young people. You know, we want to think that these issues affect women who can make really sound decisions, but we have to look at this gap of young people who are maybe 14, 15, maybe even as young as 12, up until the age of consent over 18 years old, and it varies the age depending upon the state. But there's this whole pocket of young people, women and men, that need care for STDs, contraceptives, and a whole bunch of other healthcare issues that really, if we continue to place or we continue to allow these suppressive laws to be put on the books, it's really, really going to hurt us in the long run.
Is there anything specific you want to see in Clinton's expansion of the Affordable Care Act?
One of the things I'd really love to see happen in our country, and you know, maybe the first female president who's also a mother might be the person to help lead this conversation, is about sexual education. And you know, one of the things I always try to, whenever I talk to my more conservative friends or even to more conservative groups about this issue, is as someone who was raised in a church-going household, I always equate healthy sexual education to driver's ed. You enroll kids in driver's ed before they can legally drive because you want them to be prepared for when they hit the road. And that's how we should be thinking and talking about sexual education in this country. And there are still plenty of communities where legally that's not happening. What's happening is only the sex talk pretty much consists of don't ever do it until you're married. And that ends up hurting kids in the long run. And so I really hope that we can kind of get to a place where that conversation changes at a national level. And I'm hopeful that perhaps you know, that could happen in 2017 and beyond.
You know, I'd like us to at least try to get towards a single payer model, and to really take the money. The pharmaceutical companies are they are the biggest drug pushers in our community, and that they create a drug, and then we create a condition to support the drug so that they can get paid, right?
And then they create something else.
Exactly. And I mean,
Vicious cycle.
it is a vicious, and our kids are getting on prescription drugs before maybe they just need like a healthy meal. So I'd really like to see a lot more attention to the pharmaceutical lobbyists, to the pharmaceutical company. I know. You said we could dream, right? Like what we like to see, because that, you know, we're just getting propped up on pills and drugs, and again, I do know with a I'm not so naive to think that America is simple enough to get to single payer, but I would like to see that as a goal, right? And just there's so much dirty money in our health that we can't get free, you know. And also things around fitness and healthcare. Obesity is one of the reasons, particularly in the Black community, that is draining the healthcare system. There are 30 new diseases that are directly associated with obesity, right? That if we weren't so obese, it complicates cancer, it complicates everything.
I really want to touch on something about the preventative care and the intersections. So I'm going to add a different layer here. I actually was a certified enrollment counselor, and I believe really in my heart that the Affordable Care Act was really a cloaked, I want to come up with the right words, but it was really a literacy initiative, and you'll see where I'm going in a minute. So someone would come to my desk and say, Saida, I want to enroll. Okay, great. I need your driver's license, your ID, your social security. We have to create an account. Many of the people that I enrolled did not know how to create a username and passcode. Now follow where I'm going with this. Once we created the username and passcode, the marketplace would then send an email confirmation. Many of the people, seniors, people of color, did not have an email. So I now had to sit with them and set up an email account. So now we get to the part where you get to choose. They had the gold package and all these different packages that a consumer can choose. Well, what medicines are you on? Well, I don't know. Okay, so this is what I need. So now, as an enrollment counselor, this is what I did. I created a checklist. When you go home, come back tomorrow, I need you to list all of your medicines, all of your doctors, and if you need to, bring in the bottles. They would come in the next day. Now I'm doing education on their medicine. You know what happened every time they left my desk? I got a hug. Because they, number one, did not realize how out of the loop they were with technology. That's number one. And number two, they didn't even understand what medicines they took.
I want to see more education, you know, in our community about the pharmaceutical companies. And I don't get enough of that. When I watch television and I'm watching the election coverage, I don't get enough of that. But I know when I go to the pharmacy and I buy the medicine, and if I do not have insurance coverage, and I say I don't, they give me a different option. They give me a generic brand. And the generic brand is $80 less than the brand that my doctor just prescribed. So these are things and issues that I come across in my everyday life where I don't understand how our community, the younger community, the girls who are, you know, just learning about their bodies and, you know, just getting prescriptions, I don't understand how they are supposed to function. Like this.
Thank you for watching, and please let us know in the comments section which issues matter most to you as a woman of color.